What do we expect from the medicine of the future? If the 20th century primarily directed human scientific interest outward and continued to push for discoveries related to space and the ocean depths, then the 21st century can safely be called the era of looking inward. Humanity has embraced high technology, and naturally, the boom in innovations, gadgets, and technological solutions is influencing medicine, fundamentally changing our understanding of its future foundation. The traditional healthcare system is largely fragmented, whereas technology can offer an interconnected solution. Today, people's encounters with medicine typically happen when an illness has already manifested. However, in the future, medicine will become a continuous process of preventive health care, shifting from treating diseases to preventing them. The main concept of the transformation of future medicine is 4P: predictive, personalized, participatory, and preventive. Future medicine is not about treating the sick, but about ensuring you don't get sick in the first place. Predictive medicine will be based on analyzing heart rate variability. This method, developed to monitor astronauts' health as a simple, non-invasive way to detect abnormalities, shows how the autonomic nervous system is functioning, and consequently, whether there are issues with specific organs. In the 1960s, Soviet scientist Roman Baevsky introduced the concept of the pre-nosological stage of a disease, a period when you are not yet sick but are close to it, as all negative factors have already aligned. Thinking about a person's pre-nosological state, monitoring and detecting this stage is the main task of future medicine. 30 years ago, scientists couldn't imagine decoding the genetic code. It was considered impossible. Now, DNA analysis can determine a person's predisposition to certain diseases. Researchers are working to find links between specific genome segments and diseases. In the near future, an individual DNA profile might become a mandatory part of every patient's medical record. Personalized medicine is already a real area of modern health science. This approach involves finding the best treatment methods for an individual based on their unique biochemical characteristics. By analyzing the DNA of a patient's cancer cells, we can identify specific mutations and determine which treatments will be most effective. Successful cases of cancer treatment using this method have already occurred. Additionally, tissues analogous to affected organs are grown from patients' cells, creating living models for testing. These models are used to analyze how a particular patient's organ will respond to different treatments, saving time and avoiding ineffective therapies. To make predictive medicine a reality, regular data collection is essential. This explains the rise of biohacking, with its focus on monitoring everything. Smart fitness bracelets, now a common part of daily life, can already measure many health and physical condition indicators. These wearable sensor technologies will form the basis of future disease prevention, diagnosis, and therapy. What else is expected in the future? Bionic eye. Scientists have learned to print working photoreceptors, though their structure is currently too rigid. These bulky receptors convert light to electricity with only 25% efficiency, but this is still a significant achievement. Smart lenses. Researchers are developing smart contact lenses that can measure glucose levels in tears, potentially replacing regular blood tests and easing the lives of people with diabetes. Pressure sensor. An elastic Band-Aid sensor uses ultrasound waves to measure blood pressure internally, sending data directly to a monitor. The device is smaller than a postage stamp and imperceptible to the patient. Surgical robots. The buzz around nanorobots has passed, but the idea remains. Scientists are currently testing larger robots, including one that unfolds in the intestine to remove foreign objects or help repair tissues. 3D prosthetics. In the last decade, 3D printing has entered mainstream use. While producing 3D prosthetics remains a slow and costly process, this field is growing rapidly, and ergonomically designed 3D printed prosthetics are becoming more common. AI diagnostics. In the future, AI will likely handle most basic diagnoses, leaving complex and ambiguous cases to doctors. Google specialists have used machine learning to analyze over 250,000 retinal images, identifying patterns associated with high blood pressure, cardiovascular disease, and stroke risk. Although full-fledged AI diagnostics are still distant, in some cases AI has been more accurate than doctors. VR for training. Virtual and augmented reality technologies will enable tours of the human body or the chance to observe surgeries through the eyes of renowned surgeons. The main goal of future medicine, genetic analysis, cellular programming, and tissue engineering is to give people unprecedented control over their health. Thank you for watching. Subscribe to our channel, and remember, the best way to predict your future is to create it.